Today we're doing an all-on-4, and these surgeries basically are pretty methodical. I mean, it's a step-by-step process. So after the patient's been sedated with IV sedation, we measure the vertical dimension of the face. Then we give local anesthesia after the sedation so that the patient doesn't feel the discomfort of the local anesthesia. And then step one is to remove all the teeth. Step two is to actually reshape the jawbone, because most of these cases have disease processes like periodontal disease, and then the bone becomes irregular. So we want to basically smooth out the bone and also create enough space so that the fixed teeth have enough room to be connected to the implants. So we reshape the jaw, and then after that's done, we actually, using surgical guides or positioning guides, we place a minimum of 4 implants on each arch. After those implants have been placed, we connect posts that are called abutments. And these are basically components that are going to help transfer the exact position of the implant in the patient's jaw, real time, into an impression. That impression is immediately turned into a 3D model, and then the lab technician works on that 3D model so that the patient can just relax in the OR while the recovery is taking place. So towards the end of the afternoon, like just a couple of hours later, the lab technician, who is a specialist in what he does, and in this kind of case, will then process teeth that were made ahead of time for this case, based on CT scans, based on patient pictures, portrait-style pictures, profile, and so forth. And then he creates the exact connection, accurate 3D rendering of that set of teeth, so that at the end of the afternoon, they can literally be connected to the patient, right to the implants, and then they get to go home with a perfect, brand new, fixed smile.